Hello, everyone. Welcome to the Sunshine Sessions. It's a podcast by the Sunshine Lab, which is Gujarat's first STEM based play area. I'm your host, Riddhi Patel, the founder of Sunshine Lab. At the Sunshine Sessions, we cover various topics which are very informative. They are to do with children, and we invite various experts to come in and give us their expert opinions and advice. So, in light of that, our guest today is Dr. Ashay Shah. He's a pediatric gastroenterologist. In one of my candid conversations with Ashay, or Dr. Ashay, he informed me that one of the worst things that parents can do is give a banana to their children right after they've swallowed something. And that is something that made me realize would make for a very interesting topic and a very important topic for parents. That's why we're covering that today over here. So we'll welcome Ashin.
Thank you for having me.
Thank you for joining us. All right. So we'll jump to the first question. The first question that we have is, what are the most common foreign bodies that babies ingest?
Yeah, so the foreign bodies nowadays we see are coin, marbles, keychains, or even a safety pins. And nowadays all the toys are having these button batteries, which are very commonly ingested by the babies.
Okay. The second question, what is the most dangerous one and why is that?
Yeah, so any object who has a sharp end or these button batteries, they are to be removed immediately because as you know that button batteries contains the lithium and they can emit the ion. So if it pierces the mucosa, it can cause an abnormal fistula or abnormal opening. So it can cause ulcer or a bleeding, or sometimes the child may present to us with just an episode of blood in vomiting. So these are the main foreign bodies which are to be removed urgently, and it has to be considered a medical emergency. So one is a button batteries and other are sharp objects.
Now, in light of that, how do you know? Like, સૌથી પહેલા કેવી રીતે ખબર પડે?
Yeah, so as you know કે બધા બચ્ચાઓને એક habit હોય to consume all the things in their mouth કારણ કે નવું એ લોકો શીખ્યા હોય. So the parents should be more vigilant on that. They should keep eye on them, number one. Secondly, certain things like safety pins, batteries, or any keychains are to be snugly kept in a box. બરાબર બંધ રાખો તો એ લોકો મોંમાં નહીં લઈ શકે. And some foreign bodies, even button batteries or these sharp objects or marbles, if the child consumes, it could be just an asymptomatic. There would not be any symptoms. So constantly keeping eye.
So how are you going to?
Yeah, sometimes they might have a sudden acute onset of an abdominal pain or vomiting, or whenever mother or a caretaker gives the food, the child will be difficult to swallow that food. So these are some clues we can clinch that the child has some ingested something.
The third question. Now, this is why. What should be the parents' next step after they find out that the child has ingested something?
Right. So first of all, if the parents has noticed that the child has gulped something, they must read to their primary pediatrician or a pediatric gastroenterologist if it is easily available. Number one. Number two, don't induce. What parents do કે એ આમ જોઈ રહ્યા છે ને કે ખાધું છે, they will induce by putting their hands and vomit the child. That will insult more.
Okay.
અંદર વધારે જતું રહેશે.
Okay.
Third thing, never give bananas. Why?
Yeah.
Because it is a myth that banana isn't laxative, but on the contrary, banana will decreases the motility, so it will cause more retention of that object, and it will also become difficult for us to do an endoscopy because we need to keep the child NBM, means nil by mouth, before this procedure, because we need to give some kind of a basic anesthesia. And if it would be a battery or a sharp object which is a medical emergency, and just because of banana, it will increase the time of my procedure and it will create more complications to the baby. So no bananas are to be given. That's a clear cut message.
Okay. So when you say banana, essentially, if the child has gulped something, don't give any food.
Any food, no feeding, no water, no bananas.
Just run straight to the doctor.
Just sometimes what happens, the child is playing in the farmhouse or something else, and there is an difficulty in traveling, or it takes a long time to reach to the pediatric gastroenterologist or a pediatrician. And if for a specific purpose there has been some scientific evidence, if the child has ingested this button battery, or any liquid injection like an acid or something, they can give 2 to 3 spoons of honey.
Honey.
So yes, honey is an important thing which is easily available in every home. That can little bit liquefy the mucosa, and it can not prevent, it cannot protect, but it might prevent till the baby reaches the hospital, and there may be some kind of થોડું protection મળી શકે, what we can say.
So, but that applies to batteries.
Only batteries, only button
batteries.
batteries, that's special.
Okay. એટલે button battery હોય તો honey is your
Yes.
go-to to start
Button
with.
battery is an emergency, but કદાચ ન થાય, થોડું લેટ થયું, then we can give some kind of a this honey syrup, and it has shown in some papers and some literature, somehow there are ups and downs about
Debates,
also,
of course.
but we can give rather than this bananas. So I'm not promoting the honey, but bananas to
If you are far,
yes,
then-
yes,
okay.
exactly.
The fourth question, I think we spoke on this, but if you have anything to elaborate, what are the things that should not be done?
Yeah, so as I said, don't get panic.
Okay.
What parents do is they panic, they scream like anything. Number one, obviously it has to be done. Second thing, the bananas. Third thing is to inducing by putting their
Vomiting.
hands or objects by vomiting to initiate the vomiting rather. Fourth, there are some quacks like they visit to some kind of a temple or something, and they say if you give this, he will pass in next day morning in the poop or something. It's all useless, and it will cause more harm to the baby rather than all these things.
Got it. The fifth question. So, if the baby swallowed something, then what is the procedure that it is done? How
Yeah.
long does it take?
Right. So usually whenever the child has ingested something, any primary pediatrician will do a simple basic X-ray.
Okay.
And sometimes what happens, not all the foreign bodies are catched in X-ray. In X-ray, only the radio opaque substance are only catched. Sometimes, recently before 15 days, I had a child who ingested a dice,
Okay.
that playing dice, and the playing dice is not to be
Not visible.
catched on the X-ray. So we did an endoscopy because the child was symptomatic and he was having difficulty in drinking water or in swallowing.
Okay.
Number one. Secondly, this endoscopy is a very smooth procedure.
Okay.
It hardly takes 10 to 15 minutes. We need to give a small general anesthesia, which has to be given by a general experienced pediatric anesthetist. And it's an daycare procedure. It hardly takes 20 to 25 minutes. And there is no incision or no bleeding risk are there. And if you talk about the complication, till in my recent my career of endoscopy of last 5 years, I have not seen any child landing to any complication just because of endoscopy, whether it is a diagnostic or a therapeutic.
Got it.
So it's very smooth, safe, and no incision is to be
To be
kept.
made.
Yes, it's just a flexible tube. We insert from the mouth and it reaches to our small intestine.
Got it. So again, this we spoke on a little bit, but we'll expand it further. What are the precautions that parents should take to reach these kind of situations?
Yeah, so all these things are, it's a very horrifying for all the parents. Nowadays, all these toys have these button batteries. They are to be kept snugly in a tight box, number one. Second thing, these keychains, these safety pins, these needles are to be kept away from the children, and they are kept in a certain fit that the child cannot take it. That's all we can do, or we can
Educate them.
educate them. Yes.
Is there any alternate procedure to endoscopy?
Yeah. So if this child has ingested a non-sharpable objects like a coin, like a rubber or an eraser, at least we can wait for a few hours,
Okay.
because it is not a sharp object, so it will not destroy the mucosa. So we can give some kind of laxatives, and we keep them child under the follow of. We advise the parents, rather we explain the warning signs that if these things are happening, then you need to rush to the hospital, and we'll see after 24 hours by repeating some kind of X-ray or something, and we'll see. So endoscopy is not recommended in all the foreign bodies. It depends on the substance which the child has ingested, how the substance has been sharp, and how that foreign body in which position it is there. If it is in esophagus, fundus, what we call the body of a stomach, or a pylorus, these all are the dangerous areas where even if the child has gulped before 20 days or 25 days, and even putting 20 bananas or 25 bananas per day,
It's
it will
not
not,
going to
it will not come out. It will not come out because
it.
of our
It
anatomy
is
of the
there.
child.
Got it. Going on to the next question. What if small blunt objects like coins, eraser, dice are not removed immediately? Till what time can you wait?
Yeah. So this coin and all, we can, if the coin is in esophagus, we have to be removed urgently. But sometimes nowadays the newer guideline says if the coin is in esophagus, we can wait till 12 hours.
Okay.
And we can repeat the X-ray.
Okay.
If the X-ray is showing the object is moving in the X-ray, we can wait, or we can delete the or endoscopy procedure. Secondly, for these small particles like a plastic spoons, these small plastic keychain, then others these are dyes, eraser. They are very smoothly. It can pass through our normal orifices or our normal gut. So nothing to worry about all these
Okay.
things.
So no rush.
Yeah, and usually these foreign bodies, sometimes even the button batteries, 50 to 60% will pass to the normal GI tract.
Okay.
But whenever this banana thing and these home remedies are applied, it will
That
create a
is
more
the
problem.
problem.
Yes, yes,
Okay.
yes.
All right. Now I think this should be one of the most interesting questions and also one of the most scary questions. So what are the weirdest cases that you've seen in your career?
Right. So I still remember it was a time for COVID, and I just got a call at 12 a.m. around 12 a.m. 12:30 in the midnight from my from the primary pediatrician that a 4-year-old girl had presented with the vomitings, and grandmom have strongly some kind of think she has ingested something.
Hmm.
So on inquiring the history, mother said कि उसका जो झांझर है दोनों, the patient was from राजस्थान, कि वो एक ही है, एक हमको मिल नहीं रहा.
The pile.
That the pile, झांझर, what we call the pile, anklet, right?
Okay.
So I was little bit like, okay, काम करो तो इन થઈ જશે. But the pediatrician again called me and said कि साहब આખું झांझर છે. It's an old pile. Then we did an emergency X-ray. I rushed to the hospital. The X-ray was showing that the pile was stuck in the fundus area. Whenever I reached to the hospital, it took me around 40-45 minutes. And whenever I inserted the scope, that whole pile reached to the small intestine, what we call the duodenum, and it impacted over there with causing a lot of ulceration and bleeding. So we removed by our special basket thing and we retrieved smoothly, and you won't believe it was a 15 centimeter pile.
How does one manage to swallow
Yeah.
such large things?
Yes, it's like આપણે normal દવા નહીં ખાવી હોય, it becomes difficult for us. But normally when we are not in our state, આખું નાખું બી થઈ જાય. And sometimes when I talk with my adult gastroenterologist people, fellows, they say this Parkinson patient who are suffering from Parkinson or any delusion, they swallow whole brush
Oh, so it's
because they are not in their state. And if you compare with the kids, they are not in their state. They are just started achieving all the milestone, all the pins are grief. So they think they can swallow the things easily. And recently, just before 10 days, it came in newspaper and media. 2 year and 9-month-old baby gulped a 3 large kitchen.
keychain.
Yeah, keychain.
I think I saw something.
Not a single, but it was 3. So what happened? They rushed to their pediatrician. The primary pediatrician advised them a surgery. Pediatric surgeon said we need to open this via laparoscopically. So at the age of 2.5 years, 2.9 years, parents were a bit anxious that they don't want to go for any open surgery. Somehow they just came to us. We did a repeat X-ray. Child was given 7 bananas in last 48 hours.
This child, the one
This
that was
child who have ingested a keychain, and this incident I'm talking about, just it happened before last week or last 10 days. So we did again consecutive multiple X-rays were done. You won't believe the position of the X-ray was totally the same from day 1 to day 3.
okay.
So we did an emergency endoscopy and just we removed that keychain
Without
and-
laparoscopy,
yeah, without
opening the child.
just a simple endoscopy. And other case, I was in a periphery. I have a periphery OPD there. Tailor નો છોકરું હતું.
Okay.
My father was a tailor. So on Sunday, એ આમ એમની જોડે મળવા ગયો હશે એમ.
Hmm.
So what happened? હવે ટેલર હતું એટલે પેલી જે સોય હોય ને,
Hmm.
needle he just, and
That I don't
sadly,
know how that goes down.
yeah, and sadly that needle pierced the mucosa. First 5 days, first 3-4 days, there were no symptoms. Parents were not aware, and suddenly presented with an acute abdominal pain and some vomitings. But these vomitings could be ignored. But somehow that periphery doctor was so smart. He emergency ordered an X-ray and this ultrasonography. There is an USG abdomen. Then they found there is some object inside this. Then this child was referred, and when we did an endoscopy, again it was pierced in the mucosa. And
How do you retrieve a needle like that?
yeah, there comes a special instrument where it is covered with all the mucosa, and we grasp the object, what we call the Rodnet forceps, and it's very easy and safe for the baby. And
Make it sound easy.
yeah, but when I'm talking about all these things, but after completing all the foreign bodies, the smile what we see at the parent's face, it was definitely a zenith of a satisfaction.
Of course.
Because multiple things are there you have to do for a surgery, but nowadays the medicine is evolving, and this endoscopy can do wonders. If the child is ingested the thing, within next 20-25 minutes he can rush to the hospital, and we can remove, and we can save the child, and rather save the child from a dreaded complications,
Of course.
because all these things are very risky sometimes.
So that's why I thought this
Yeah.
talk is very important, because
Exactly.
that I think banana is something anybody would do.
Exactly.
This is what I've grown up hearing.
Even in a good families, you won't believe.
Of course, because that's how we take
Exactly,
it.
exactly.
And then the applications
Exactly.
and the implications are, yeah. All right. So I think that about covers it. Yeah. Thank you so much for being on the Sunshine session. And thank you for all the information. I'm sure everybody who is watching is going to find this really, really
Exactly.
informative. And I think if it even helps one person
Exactly.
from making those mistakes, it's worth it. So thank you so much for
Thank
being
you
here.
again.